And then you got that layer, and you guys can see it right. Can you see it right there?
Yeah.
That layer right there, that white layer.
The connective tissue. So you have the white layer under the orange layer, then you have the triangles, and then you have the cells within the triangles, right? And if you think of all of that white as your connective tissue, it's the same way in your body. Fascia is your connective tissue. It runs from the crown of your head down to the base of your feet. When there are restrictions in your fascia, it puts pressure on nerves, creating pain. It puts pressure on your muscles, restricting strength. And it can also restrict range of motion if it's a muscle around a joint, right? And it can put pressure on your organs, restricting function. If you have somebody that's addressing the bones and getting them in right place, but you're still having a lot of pain, sometimes it's that piriformis, it's that soft tissue that's causing some of the problem. And so that's where we can work really well together.
People used to say, what's the biggest organ in the body? And everyone used to say what, if you knew a little bit? The skin, right?
Skin, yeah.
But just a few years ago, what got reclassified as the biggest organ in the body? The fascia.
Yeah.
So again, most likely, you just kind of go with, well, what do I have the most of? I have the most fascia. I might want to find a practitioner that treats fascial adhesions. It's that simple.
Hello, everyone, and welcome to Polish Your Life. Today, we're going to talk about myofascial release and how myofascial release is actually different than massage. I think all of you should pay attention, and that's because myofascial release can really help you, or if you're a doctor, your patients, get better faster. You may have some questions. You may also have something to add. And we always encourage you to write comments below and to share this video with other people who need to see this. We are here with an awesome guest and also an awesome co-host. So I'm going to let our co-host introduce our guest. Dr. Todd Johnson-Ba is going to introduce Darlene. Dr. Todd, why should people pay attention today?
Oh my God, Mike, today is about the fascia. And I was telling people today, oh my gosh, I'm a fasciaist. And people are like, what? What? We just got rid of that. I go, no, the fascia, now considered the largest organ in the body. But before I introduce our guest, Mike, I just want to give you a big thanks for all you do for Polish Your Life and creating a forum where people can talk and collaborate. So thank you again, Polish Your Life.
Oh, thank you.
Yes, such a great
awesome. So now here's my good friend, and oh my gosh, Darlene, we've been hanging out for what, like 50 years or so?
12,
okay, like
12 years, yeah. It feels like 50.
Yeah. And I've seen you grow so much. You came in as a yoga instructor, and now today we're talking about your work as a myofascial release practitioner. And awesome. Now, what I want everyone to know is Darlene, it comes through healthcare a little longer path than a lot of folks. Some people go, I want it. Yeah. So Darlene's background, she begins as a mechanical engineer, and then she gets to holistic health practitioner. So Darlene said, let's let our guest, everyone know how you got that journey. And then I want to delve into the exciting world of the fascia.
Absolutely. Great. I would be happy to talk about that. And thank you. Yes, Mike, thank you for all you do and this incredible community you've created. And it has been such a fun journey working with you, Dr. Todd, sharing clients over the years. So I started with a 12-year career in mechanical engineering. And my journey through yoga was really, I was a little stressed out, working lots of long hours. I was traveling back and forth to Europe and Asia. And they usually say when the student is ready, the teacher will come. And I hit a point in my life where I was having some difficulty and pain in my body. And then my mother was unfortunately dying of ovarian cancer. So when the doctor said, there's nothing more you can do, we ended up being on a plane and on a beautiful beach in Hawaii, this amazing angel came into my life and shared the gift of yoga with me. And that was really my first dive into, well, what is yoga? How does that work in the body? And I took my first class, and over those next couple of weeks and months, learned tools for breathing, relaxation, getting stronger in my body, getting rid of pain and balance. And it started me on this pathway to look at all sorts of different ways to help and impact health. So I started teaching yoga on the side. And then eventually when I got married and moved, knew we wanted to have kids, I actually went to massage school, and then it just continued on this journey. And as I continued having accidents, hurting in my body in various ways, I would learn new modalities and eventually just really wanted to follow my passion for health and wellness. So I actually met Dr. Todd 3 months after I had my first daughter. I was having some, secret iliac joint, SI joint pain, and realized that it was actually related somewhat to my C-section scar. So it's wonderful. We're going to talk later about how soft tissue work works well into bone work with chiropractic and how they work really well together. And it was nice to see that connection. And so just over the years, it's been open doors and learning through yoga, myofascial release therapy. I'm now a doula. I teach birth workshops. I do a bunch of different things in the area of nutrigenomics. So it's really holistic health and trying to get to the root cause, not just treating symptoms, but finding the root for folks. And whether that's something that I do or collaborating with other practitioners to help find solutions for our clients.
So you work with, you're a myofascial release practitioner. Is that the right term that we use?
Yep.
So how is myofascial release different than massage?
Yeah. And I get this question a lot, and it's interesting. I used to always get calls for massage therapy, and then I'd have to educate them on what is myofascial release and how is it different. And now over the years, it's amazing because I'm starting to get a lot of referrals from other practitioners. And as folks are getting more savvy with their health, they're looking it up and noticing that that's what they need. And then now they're reaching out for myofascial release. So what is it? So most people are familiar with traditional massage, undress to your level of comfort, get it down. It's usually using some lotion and working into the soft tissue, sometimes deep tissue and things like that. Massage is wonderful. It's relaxing. It's great for circulation. One of the limitations of traditional massage is that it really only works on the elastic component of the muscle. So we're talking about the elastin fibers instead of the collagen fibers. So what that means for you, if you're a patient or you've noticed that you've gone for that massage, you walk out feeling blissful and relaxed and feeling so good, but maybe that next day or by the end of the week, maybe you've kind of started to tighten back up again and that neck tension or that headache comes back. So it feels really good, but maybe not as long lasting as you were hoping. And that's really the benefit of myofascial release. And it's something that, occupational therapists can do, physical therapists can do. And I'm a massage therapist specializing in myofascial release therapy. And so fascia. What's that?
Chiropractors can do this as well.
Oh, yeah. Yep. Absolutely. Absolutely. Yep. So fascia is your connective tissue. It runs from the crown of your head down to the base of your feet. It's typically vertically oriented, although there are some horizontal planes like pelvic floor and the joints. And if you think of it sort of like a web-like structure, because, nerves and blood vessels have to flow through it while it's continuously supporting and separating through the body. Now, Dr. Todd, Mr. Mike, have you ever seen an orange? You ever cut an orange in half? And you see the triangles, right? So if you're at home, you've cut an orange in half, right? You see the orange layer on the outside, you see the triangles, or you see the white layer under the orange layer, then you see the triangles that are white. Are you going to get an orange? He might cut an orange in half. So you have the white layer under the orange layer, then you have the triangles, and then you have the cells within the triangles, right? And if you think of all of that white as your connective tissue, it's the same way in your body. So around your muscles, and then the muscle fiber, and then the muscle fascicle, and it works all the way into the cellular level. Are you going to cut an orange?
Yeah. Yeah, there we go.
You got to cut it so you can see the triangles.
Okay, wait. Tangerine, does this work?
Go for it. So basically,
yeah. And then you got that layer, and you guys can see it right. Can you see it right there?
Yeah.
That layer right there, that white layer.
The connective tissue. It's right. If you've ever eaten, chicken, and you've got that thin white layer on the outside of the chicken or the backbone of your ribs. If you eat meat,
yeah, it's kind of like right there, like that stuff.
Yeah.
There it is. Like, see how I'm pulling that right there.
Absolutely. And if you've ever tried to take that like really strong, thank you, Dr. Todd, that was fabulous. If you try to take that strong layer of fascia off your chicken too, you'll notice it's pretty strong, like 2,000 pounds per square inch strong. right? And when there are restrictions in your fascia, it puts pressure on nerves, creating pain. It puts pressure on your muscles, restricting strength. And it can also restrict range of motion if it's a muscle around a joint, right? And it can put pressure on your organs, restricting function, right? So what we do in myofascial release is we apply either a compression or a traction in some way. And the critical thing is to give it time. So I've been trained by John Barnes, one of the leading experts and developer of myofascial release, about 250 hours of training with him and his team. And so when we apply this gentle pressure sustained over a long period of time, you release not just the elastic component, but you get to that fascia, that connective tissue, those collagen fibers as well. And that's why we get the results that we get. And after like the 5-minute mark and beyond, so it takes some time, but you actually get a release of interleukins, which are your body's natural anti-inflammatories. So it works so well in lots of different ways, both mechanical and chemical as well.
So is there a typical myofascial release patient, or is there like, if I have, obviously now, if I have chronic pain, if I have loss of range of motion, if I am not healing well in an area, I should consider myofascial release.
Yeah.
But is there some, is there a better, what's your typical client that you see?
Yeah, that's a good question. And honestly, one of the reasons I love this work is I have been able to use this literally on, I'm also a trained birth doula. I've been in the delivery room with couples, helping them through the birth process. I teach pregnancy yoga and birth workshops. So I have literally done this type of work on newborns as old as an hour old. I worked at a pediatric rehab hospital, so lots of children, up through, I think 93 was my oldest client. And it can be really effective for a lot of different things. The majority of people come to me either with an acute injury or a car accident or something like that. And many struggling with chronic conditions. So it could be fibromyalgia, it could be a lot of back pain, sciatica, sometimes joint, knee and shoulder joints, a lot of mostly neck and shoulder headaches, back pain are the majority of my clients. I do work a lot with pregnancy support. You do not have to just accept that because you're pregnant, you're uncomfortable. Please don't think that. There's so many things that you can do to help. I also have started to work with some college athletes, like college football players. I've worked with young, teenager athletes in schools that have been noticing some imbalances in their body. And if you have children that you're noticing are not feeding well on one side versus the other, or having imbalances as they're learning to walk or work through their day. I think I have a 4-week-old client I'm going to work on tomorrow with post lip and tongue tie. So pretty broad range of clients. So if you're a patient out there that's struggling with any of those things, I'm happy to help. And if you have, clients, if you're a practitioner.
Yeah. And I know some clients that we have seen over the years where they go, yeah, Todd, I've had low back pain for a long time and it gets better after the adjustment. And then we start going, well, when did this really start? Well, it started 6 months after I had children. Okay. I was like, all right. And then we start checking. And so everything's been worked on. They've done the great chiropractic work. They've done all the good balance training we do. They've done all the great physical therapy. Yet I go, you have a big, how did you deliver? Oh, cesarean section. Oh, so that's, if most everybody's familiar with that, but that's when you have to cut a lot to get the baby out. And that can leave a big scar. And we're like, oh, so I would just start before I knew of MFR, myofascial release. I'd be like, well, let's just start working on that. And they go, oh my gosh. They'd come back and go, Todd, I hate you. I have more pain in my abs than ever, but my low back feels great and it holds. And I was like, oh, this is really good. There might be something to this. And then we see people with chronic neck pain and I go, well, since how long have you had it? Well, by the way, I've had open heart surgery and I had that 5, yes. You see where I'm going?
Open heart surgery at 13. Yep.
So if I, and they said, and I've had the pain ever since. And I go, why has anybody gently tried to tease some of that tissue loose? No. And again, oh my gosh, what are you doing? Because I'm not spending as much time as an MFR person does. I'm just getting right to it. And it's not as a pleasant experience. I mean, still, it's a tough experience and it can be emotional for a lot of people. But again, it's looking at, hey, when does this pain begin? So if you all are looking at something and you go, I had a foot surgery and 6 months later, my hip is really hurting, you might have to backtrack. So it's really about going back to the root causes. And some of our patients, when we talk to Darlene, are amazed at how far back we go during the interview process. Is that the case? Like, are some people like, why are you asking that? Give us an example of what like an intake might look like.
Yeah, absolutely. Absolutely. So, John Barnes talks about it and so many others do, like, find the symptoms, look elsewhere for the cause. And we have that conversation all of the time. So, if you think of your fascia as your connective tissue, sometimes it's a pull in the hip that's pulling down and it's pulling up to the shoulder. So you're going to your massage therapist, you're going to chiropractor because your neck hurts and you're getting treated for your neck. And I know Dr. Todd knows this, so he's addressing all of the root cause, but not everybody does. And so what can happen is that you're working in one area, but it's not actually resolving the root problem. So maybe you had a fall on ice a year or two ago and you pressed into the bottom of your tailbone and now it's pulling up and causing your headaches. Or you've got, an upslip or rotation in the pelvis that's creating your neck and shoulder pain because it kind of crosses the body. You fell on this hip and then it's this shoulder and this head, or that knee, it tends to cross the body. If you don't mind, I'm going to take out my pelvis here because this is such a great discussion about root cause. So working at home now in COVID and teaching pregnancy yoga online, it was nice to have visuals. So obviously if you're pregnant, baby's in here, but when you're, the average person who's having back pain, a lot of times we talk about sciatica. Dr. Todd, you see a lot of people with sciatica and back pain, right? And SI joint dysfunction, right? A lot, right? So many of us do. So this, you got your triangle bone, your sacrum here. And because your external hip rotators go from the edge of your sacrum out to this greater trochanter out here in your hip, in the femur. So because they sort of go horizontal across the body, as things spread in pregnancy, it puts pressure on that sciatic nerve. But sciatica can actually come from one of three things. It can be from the disc pressing on the nerve that's going through and into the sciatic nerve. And then absolutely, Dr. Todd is your guy, right? If it's coming from the disc, absolutely, right? Or chiropractic and that type of work. It can be from the SI joint, the sacroiliac joint being stuck. And sometimes it's the opposite side that's stuck. Or it can be Piriformis Syndrome. We have 6 external hip rotators. Piriformis is one of the main ones you hear about because it goes across and presses right on that sciatic nerve, right? So if you have somebody that's addressing the bones and getting them in right place, but you're still having a lot of pain, sometimes it's that piriformis, it's that soft tissue that's causing some of the problem. And so that's where we can work really well together to make sure both are getting addressed. And talking about root cause, often the pain is on this side, but it's the problem is this side is tight. It's pulling the sacrum this way because this is the tight side and all your symptoms are over here. So that's why you got to assess both and figure out where it's coming from. And I know you've got some amazing doctors and healthcare practitioners that understand that, but it's important if you're a patient that you've been going, this side's the one that's hurting this side. Why are you bothering to work on the other side? Or I'll hear, oh, I have all this back pain. Well, it could be your hip flexors, your psoas, your abdomen. And most massage therapists will not touch the abdomen. And I get so much relief of the back by working the front, right? The front is just the front of the back, right? You see that in your practice too, I'm sure.
And Darlene, what you said right now, I think is very important for people to understand is that there is always room for collaboration. And sometimes even patients and even providers get confused because they're like, okay, if I have so many different things that are interconnected, at the same time, I only have 24 hours. So how am I supposed to fit all these different providers to make sure that they're nicely integrated for my best outcome, but without doing too much? So what you're describing as collaboration with Dr. Todd and chiropractors and other practitioners, I wanted to touch on the integration component because it's going to be, especially in the context of our doctors networking group, it is the key for people to know that they don't have to choose one practitioner over the other. What you're doing, if you're watching this or if you're a provider, just be aware that if you're a part of a network like the one that we are building, it doesn't matter if you go to a chiropractor first, as long as they know that you need myofascial release, you're going to get referred. The same with acupuncture, and the same with Darlene. If you're getting a client, you know that if they need chiro, PT, or pain management or anything else that is appropriate, even talking about OBGYN support, right? You're going to refer back to these practitioners. So let's talk about integration, if you don't mind, because this is the one that gives me goosebumps when I think about, from patient's perspective, how awesome it is to come to a provider who is part of a network, and now they literally got your back.
Absolutely. Absolutely. Oh, and Dr. Todd's been taking great care of a lot of my clients and my students that I've sent to him in the past years. And one of the things that we discovered over time was, unfortunately, with the way the chiropractor and a lot of the patient care is set up, that is, he doesn't have the luxury of being able to spend an hour with each person, right? So sometimes it's really nice. He goes, I can take care of this, this, and this, and then he can send them to me or other practitioners where I'll spend an hour or 75 minutes with somebody, sometimes 90 minutes, to actually take the time to work out that soft tissue that's pulling on the bone. So if you're finding that, I go for massage, I feel good, but then it tightens back up again, or I'm going to the chiropractor, I feel amazing for those next few days or weeks, but then I have to keep going back over and over again. How we work really well together is, I think we each help the other one be more effective. And the whole goal is for our clients to feel better. And I think it's never like they're my client or your client. I think when we work together and clients, get better and get better faster, like I know, in switching from massage to myofascial release, I've had, so much better results. Maybe they don't come to me as often, but I don't think of that as I've lost income. I think of that as fantastic. If I'm doing my job, you don't have to come to see me as often. If I can refer you, I do what I do best and I refer you to others and we get you better faster, you're going to tell others and send the ones that are in acute and chronic pain to us. And we're just going to help more people feel better, live vibrantly, live healthily. And that's really the goal.
And we talked off camera, we also talked about it, which is a very healthy approach to patient care, is that by having more practitioners in the mix, you're not spending more time, you're actually cutting down the time. Because, for example, and I know that Dr. Todd operates the same way, is we need to find the minimally invasive and very effective type of treatment, right? So if we're going to have MFR that helps release some of the tension that is there, that would make the adjustment not hold for long enough, if there is a combo of both of these therapies, maybe they don't need to come, 50 times. All they need is a little bit less. So let's talk about that, Dr. Todd, because I know that is your philosophy, to get the patient as quickly as possible to optimum results.
Yeah. So let's go back and let's talk about MFR just a drop more. What we want to realize is, so Darlene, if I'm a practitioner referring to somebody and I'm looking for certain signs in a person, what symptoms might I see in a patient that would indicate that they are a good candidate? My mind already for MFR, I'm thinking, oh, you've had like surgery. You're going to have a lot of adhesions from that. Other injuries, things like that. So I'm a lot of times I think of MFR, I think a lot of times surgeries, I think of procedures, and I think that creates a lot of adhesions.
Yeah.
But are there other symptoms? Give us like 3 or 4 little snippets we can look at providers when we're going, oh, this might be the reason to collaborate with a myofascial release person.
Absolutely. So this is a great, great question. And one of the challenges is, how do you know if you have fascial restrictions if you're a patient? And the difficult thing is they do not show up. Fascial restrictions do not show up on X-rays, MRIs, and CAT scans. Okay. So unfortunately, what we'll do is
a little bit on MRIs.
Yeah,
they do. I mean, are you see like little lumps in there or something like that? At least it'll give you an indicator, but you're right. It's not like we're going to see a report, myofascial release, but like as a provider, you're starting to look at those layers. You can start to see some stuff. We can talk.
Yeah.
Oh my gosh, we'll do that next time.
Yeah, absolutely. Absolutely. So what you might notice is, so certainly scar tissue, absolutely. Scar tissue, you can also find imbalances. So if you go, I can make this arm go this direction, but this arm only goes this direction, often there's a soft tissue, ligament muscle of impact and fascia and impact for that. Sometimes fascial restrictions are affecting, you might have constipation, you might have pelvic pain, you might have, a lot of headaches and neck tension, ringing in ears, eye problems. There's fascia in all around, like the dural tube up to the head. If you've had, sometimes you have scoliosis. Scoliosis might have been a child with torticollis, and they, put the helmet on the head to try to get the head to look, and I know they do some structural work improvement there, but if they're not affecting the meninges, the soft tissue, the dural tube, and releasing that connective tissue, then it's going to create imbalances and twists and torsions in the spinal column that can lead to scoliosis, right? So we can, in the case of scoliosis, we've got muscles and things that are pulling the bones out of alignment, right? So Dr. Todd's going to help and get them in place, and then I can help release some of the things that continue to pull them out.
So let me give like 4 things that popped in my mind as soon as you said that. So I'm thinking surgical, like if you had a surgery and then after a surgery, you find like years later, you're having issues. I had surgery when I was 2 weeks of age, saved my life for a gastric problem I was having. But hey, years later, I developed a lot of adhesions. I still need to see Darlene for that a little bit more. 2, radiation therapy. After you received radiation therapy, and you can have adhesions in an area that come from that. And after you get the release to see somebody for manual therapy, MFR can be good. Chronic bracing can be an area that was braced before. As a child, we're correcting, hip mechanics, or like you said, we have the brace on to help remodel the bones of the skull, things like that. Appliances for the jaw, or appliance, again, that's a form of bracing, or like even appliances for the foot, all possible areas there. And then finally, an area that's been injured. So when I think of that, and possibly chronic, so those are some great areas I think of MFR. I know I'm kind of limiting it, but I wanted to make it real easy for folks to go, hey, that's a slam dunk for MFR.
Absolutely. Absolutely. And TMJ, there's a lot of things with whiplash. You have the masseters, the pterygoids inside that I can get in and do some of that intraoral work and in the jaw, and just spend the time that, you might not have, other practitioners might not have.
Yes, and then we have folks that have had thyroid radiation therapy, or they've had, and adhesions that have formed there. People don't think about that. Or people that have had even a food tube that's been put in, hyoid bone shifts off, throws off the don't get me started, sorry, but throw off
yes, we can release.
That's an appliance that can throw off, but that's the level of sophistication we can get to this. So anyways, I think we at least summarized where you're thinking manual therapy can help, but we need a deeper level of it. I think MFR is the way to go.
And I think a lot of people underestimate. They're like, well, I didn't have a surgery where they cut me over. Like maybe it was like laparoscopic, and I just have this little tiny incision, right, where they went in with their tools, but they don't realize that that tool going in and coming out, even if it's a single dot, leaves a scar through the entire thing. So now you have issues with the bowel. Now you have issues with like all sorts of things just from that little tiny incision. It makes a big, big difference.
Yes.
So,
yeah.
Absolutely.
Yeah.
And then fibromyalgia and things like that, where they're going, well, I don't really have a root cause. Fibromyalgia is often like, it's just a series of symptoms. And a lot of that can be fascial restrictions, putting pressure on nerves and things like that too.
So Darlene, you and I could end up talking forever, but we do have our host here. Mike, I know you're dying to get in. Go ahead, share. What are your insights, Mike?
It just warms my heart to see providers actively collaborate, because we are not talking about a Zoom call that we have right now and a conversation that is already very good, because you watching this, you can learn and kind of like you have the in on these conversations that are happening normally behind the scenes. Right now, you can see some of these conversations take place. But it warms my heart because I know, and I know both of you, so I know that this is a long-lasting, constant relationship to help the patients get better faster. It's ultra important. And I just wanted to make sure that, Darlene, because you explained myofascial release very well, we understand it's different than massage. Massage goes more on the soft tissue part that is not including the fascia. Myofascial release is a much deeper therapy that may be sometimes confused, but it's different. And then Dr. Todd, you also asked very good questions and identified some key factors that could trigger a referral to a myofascial release practitioner. So I appreciate that as well. I wanted to just make sure, Darlene, do you have something that you would like to add for our audience that maybe you didn't say, but you feel like we really should before we go?
Absolutely. I love this idea of collaboration. And if you're a patient out there and you are in pain, I think, especially with this group, please know that, so often I hear, well, the doctor said there was nothing more I could do, or they said I would just have to give up running, or they just said, well, I guess you're not going to be a tennis player anymore, or something like that. I think, we hear those things, and often, especially with this group, I think there's such vast knowledge, and we so much more now that you don't have to accept that, I think sometimes. So please reach out if you're hearing that, especially, fascial restrictions play a role. Inflammation plays a role, cellular support plays a role. So we didn't talk about that, but there's ways to reduce, cellular stress that can also make the other things that we do more effective. So, if you're a patient and you're questioning, is this something that can help, certainly reach out. Happy to have a conversation with you. And if you are a practitioner and trying to figure out how I could potentially fit in or how we can work together, absolutely reach out. I do have some brochures about what I do. I do pregnancy yoga for moms, birth workshops. And I have some additional flyers that I'm happy. So if you have a wellness center or a practice and you'd like to, maybe see if we can collaborate, I'm happy to get you some literature about what I do. And you can find my website is bergenerhealth.com. So BERGENER health, HEALTH.com. My phone number is 919-YOGA-MFR, which
Awesome.
can be found on my website. So it's an honor to be here and to share this information. And I'm just, passionate about, getting to the root cause and being a solution, and a lot of pregnancy support, a lot of young mom support. And because the whole goal is we want to be as healthy and vibrant as we can so that we can go live our life limitlessly. I'm very, very, very passionate about not being able to sit on the sidelines, not having to sit on the sidelines of your life and just watching the kids play. Like, go out and play with your kids and be around so that you can play with your grandkids and be vibrant and be able to move without limitation, right? I don't want anyone's body to be the limitation of them living as fully as they can. And you don't have to accept that. So I think if we work together, we can get everyone out there just living vibrantly, sharing your gifts with the world, be limitless so that you can go out and do the work on the planet that you're meant to do.
This is awesome. And we encourage everyone watching, especially if you're a provider, collaborate with Darlene. You may have questions, you may have something to add, you may want to connect. So definitely connect through social media. Where can people find you on social?
Yep. It's at bergener.health.
Excellent. Very good. Very good. And Dr. Todd, thank you so much for your questions. I think this is very important for people to see the active collaboration.
Can I interject one last thing?
Of course.
About fascia and everything? Now, as we began, remember, people used to say, what's the biggest organ in the body? And everyone used to say what, if you knew a little bit? The skin, right?
Skin, yeah.
But just a few years ago, what got reclassified as the biggest organ in the body? The fascia.
Yeah.
So again, most likely, you just kind of go with, well, what do I have the most of? I have the most fascia. I might want to find a practitioner that treats fascial adhesions. It's that simple. Okay. I'm stopping. Go ahead,
No,
Mike.
very cool. Very cool. And it's, you know, what you have the most of, and we like to always get the extremes and identify them. To me personally, the biggest problem and the most of attention that we put in this group is in a one major problem. And that is that a lot of people, so many people go from doctor to doctor. Even if they follow recommendations, they still don't get better. And we think this is wrong. This should not be like that. And not a lot of people do something actively to make a difference. So what we have going on with the group is we have a way to get a lot of people, providers and individuals, to collaborate, work together, to put a big dent in this big problem, and then get people to live without limits, like Darlene said. So thank you.
The main thing there's not one size fits all for everyone, and there are so many ways to approach your health. And I have, it's kind of fun because I'll have clients that'll book me for a private yoga class, and halfway through our yoga class, they're like, well, gee, this is so much easier on this side than that side. And we talk about, well, there's, probably some fascial stuff going on there. They're like, well, can you address that? Absolutely. Hop up on the table. I can do myofascial release. And then we go back to the yoga and we're like, wow, that's so much easier now. Or we have people that come in for fascia because of pain and we're working on that. And then we say, oh, well, would you like to know some stretches or other ways that can handle that? We can, help to work with that when you're at home. Let's do some self-treatment things so that when you come back next time, you're further along. Fabulous. That works wonderfully together. Oh, you're feeling stressed and overwhelmed and anxious in addition to the tightness in your body. Well, gee, there's some yoga breathing practices and meditation can help with that part, right? And so there's so many ways to help support our clients, and it's not a one fits all. So I think finding practitioners that do have multifunctional ways that they can help and support is, again, just a gift. So, and Dr. Todd, thank you for all you've done for me and my health and my back health, and for all of my students and patients over the years. It's been so wonderful collaborating with you and referring with you. I appreciate it.
Right back at you. And for everyone else out there watching, yeah, Darlene always brings this much energy to every interaction. Yes. So you're never going to get Darlene going, oh yeah, let's sprawl it out there. Let's turn it back where we started, to our host and Grandmaster of Ceremonies for Polish Your Life, Mike, as we finish up strong there.
Thank you so much. It is just awesome. I want to be respectful of your time and of our viewers' time. So we know how to connect with Darlene. We know why you should connect with Darlene. And you already know Dr. Todd and where he practices. For those of you who don't remember, Columbia, Maryland. And I wanted to tell everyone watching that these type of videos and these type of connections are very important, and we need your help in spreading the word and message. So comment below, connect with our people, collaborate, but also share the video with other people, because who knows, maybe one share will open somebody's eyes, and then you're gonna save them 10 years of trying to figure out what they should do to feel better. So your share will matter, your comment will matter. If you're watching on YouTube, subscribe. If it's on Facebook, follow us, and we will not disappoint you.
Woo!
Take care. All the best. Take care. Bye.